Hello and welcome to AFD TV. I'm your host Siddhartha Samajala, and here with me today is Dr. Sam and Dr. Drury. We're going to talk about ADD, or Attention Deficit Disorder.
Thank you, Siddhartha, and welcome, Dr. Drury.
Thank you.
So, tell me about ADD and what type of testing you do, and treatment.
Treatment, yes. So ADD is attention deficit disorder. There's also can be a hyperactivity component, and so often the children with ADHD will sort of zone out in class. Oftentimes it shows up when they're starting to be challenged in school. And so when parents have concerns or teachers have concerns, there are a few things we can do. We can do some testing. We'll have the parents and the teachers fill out some questionnaires so we can get an idea of how that child is functioning in those environments. And then also there's a computerized test that we can give them where we make it very boring. So if they have attention problems, we'll find out.
Yeah.
And then there's also an assessment we can do with EEG. There are certain brainwave patterns associated with ADHD and ADD. And oftentimes, when a child comes in with those problems, we'll see that particular pattern. And
So what's the youngest age you test?
we currently have a 4-year-old patient.
Oh, wow.
Yeah,
And
he
then,
was having some problems in preschool and came to us.
Oh, boy. And then what about, what percent do you do as kids versus adults?
Right now we're doing mostly adults because we've just opened the new clinic in Brentwood, and before we were seeing a lot of the patients at our functional medicine practice.
Sure.
And so far mostly adults, but I would say that neurotherapy and neurofeedback in general is predominantly a treatment, or a lot of the providers who are doing this are seeing children.
Sure, and because a lot of times the parents would rather see if they can treat them without medicine,
Right.
and to go through neurofeedback, whereas a lot of the adults are maybe impatient, just want pills.
That's right. Neurofeedback has actually, within the past couple of years, been recognized by the American Pediatric Association as a level 1 treatment for ADHD. So they gave it the same level of efficacy as Ritalin and
Wow.
psychostimulants like that.
So for an adult who goes through testing, you diagnose with ADD, what would be the treatment, neurofeedback?
So it's similar to all of our neurofeedback treatments. We do an assessment to begin with to identify any brain activity that is too slow or too fast. And then we attach the sensors to the person, and we let them sit in front of a computer with a DVD or a movie playing or a game. And when they start to zone out and lose that attention, the video goes, it starts to fade away and this volume goes down. And then when they sit still calmly and are able to focus, the video comes back. And in that way, they're able to learn to self-regulate their attention. So that if they want to zone out, they can. But if they want to be paying attention, then they know what that feels like.
So with a lot of the ADD, there's periods of hyperfocus and then hyper zone out.
That's
It's
right.
just more across the board versus getting it more modulated.
That's right. Or being in control of when it happens.
Ah.
So when you're sitting in a board meeting, you don't want it happening. You don't want the zone out happening.
Well, that's what they call them, board meetings. Well, General Electric and a lot of large corporations, what they've done, which was very clever, is all meeting rooms, they have it at standing height only.
Yes.
Yeah, and
Yes.
that's less likely to tune out.
That's right. And again, when you're moving and you're exercising, that also does a lot for attention. Exercise, diet, there are a lot of ways to address ADHD without medications if the parents are reluctant to try medications.
Even when we see patients in our exam room, we have desks that for the computers that we're at standing height.
Yes.
I recommend a lot of our patients who are afflicted with what I call cubiculitis, if they can get desks that rise up. My father is a radiologist, and they actually have treadmills where you can actually walk on and read x-rays, which is pretty neat.
I think we considered that for Maxwell Clinic, but we were concerned about the noise level.
All for treadmills?
Yeah.
Oh, really?
Yes,
Oh, yeah.
yes.
Well, I think just having a desk that you can raise
Yeah.
your computer
Yes,
up
yes,
helps.
and we do have this.
Oh, you do?
Yeah.
Okay, yeah, same thing,
Yeah.
yeah. So that's pretty neat. So,
Yeah.
what about coffee or tea? As far as stimulants, is kind of a natural approach for helping focus and.
Well, I mean, most of us know it definitely helps, but it wears off, and you usually crash. And so, again, there are other ways to focus in on your attention. I'm not going to say don't drink coffee, because I do.
Oh, I love my coffee. In fact, I love not only my coffee, I love my Keurig.
Oh, yes.
That's my cure for if I feel like I'm not focusing. Go fill up my cure. I mean, I think anything in moderation is fine.
That's right.
Yeah. So, well, very good. Well, well, thank you for joining us. And
Thank you for having me.
thank you for watching AFD TV. And this is a fascinating subject. And hopefully I didn't zone off while I was doing this. So we'll have to go back and watch the video and make sure, I'm at full alertness. So
We'll hook you up next time.
Okay, yeah, hook me up to the NeuroCap. Thank you so much.
The medical advice provided in this video is informational and strictly the opinions of Dr. Samudrala and AFD Clinics. For a personalized medical opinion, please consult your primary care physician or visit one of America's family doctors' clinics today.